Hey, this is Don Walters coming to you from theclinicaltrialsguru.com. Hey, listen, something that I've run across is just some pretty interesting experience. I've had patients when I've worked with different clinical sites, and I've run across these patients where, we might diagnose them, bring them into one site and they diagnose them with schizophrenia. Then I find out they've been going to another site and they've got them diagnosed as bipolar. My question is why is there such a vast difference in the diagnosis? Now, I can understand if they said schizoaffective. Maybe they're bipolar with, schizophrenia tendencies or schizophrenic with bipolar tendencies. But to be diagnosed bipolar and put into bipolar studies and then be diagnosed schizophrenia, put in a schizophrenia study is quite interesting. The only thing that can bring the question to my mind is maybe some of these clients might be one or the other, but just really good at playing the part, where they're able to fool the doctors and fool the staff. They know exactly what to say and what not to say, and what behaviors to exhibit. So if I don't know. So I guess that's why it's very important to thoroughly interview these patients. And I think one of the best ways to do that is when you first do a pre-screen with your client, don't even tell them what you're screening for. If they come to you about a schizophrenia study, so that's fine. But, let me ask you a few questions before we even get to that point to seeing whether or not you fit for schizophrenia or bipolar. And just start asking questions. Or don't even say that. Just say, okay, and just start asking questions. Have a list of questions lined up. If they're looking for schizophrenia, then start asking them questions that will definitely put them in a category for schizophrenia, just to find out if they're really bipolar. And vice versa, if they come in and they're looking for a bipolar study, and I kind of said it backwards. So if they're looking for a bipolar study, just start asking questions immediately that pertain to somebody who's schizophrenia. And if they're looking for a schizophrenia study, just start asking questions pertaining to the Weimar, the Young Mania ratings, just to find out if they have any bipolar in them. And that kind of gets down to the bottom where you can really start digging and say, hey, if it looks like that they're bipolar by just some of the questions you're asking, then you got something to dig into and say, hey, look, what's really going on? Have you been doing studies for bipolar? So, you need to tell me, because we don't want to get you in here and run into problems. Because you understand, some of these people are looking to make money when they do these. Not some, but a lot of them are looking to make money. So they're going to do whatever they need to do and play whatever games they need to play to get into those studies. So anyway, if you got a patient that comes in and is looking for a call you up, or you meet them face to face and they're looking for a schizophrenia study, ask them some of the questions pertaining to the Young Mania or pertaining to bipolar, and then just vice versa. That might help you determine whether or not you've got somebody that really is going to fit the bill. Because other than that, if you tell them schizophrenia, yeah, we got a schizophrenia study and we're looking for this for schizophrenia and that for schizophrenia, then they're going to really try to play up the part sometimes to get in. And even if you got somebody that's truly schizophrenic, they're still going to be trying to feel you out on where they need to be. Because sometimes even with a study that say schizophrenia, they may have to be at a certain rating with the, on the PANSS or the SANS, and they're going to try to see where they need to be, not so much them understanding the ratings, but see exactly what you're looking for, and so they can determine how they need to act and what they need to tell you. If they think that telling you too much is going to rule them out, they're not going to tell you much. If they think telling you everything's going to get them in, then they're going to tell you everything they can tell you to get themselves in, even if some of it's fabricated. So it can be a very tricky thing. A lot of these patients are very savvy, so we have to be careful there. So anyway, again, if they call you up looking, hey, do you have a schizophrenic study? And you don't have to say yes. So, well, you know what, before we do anything, let me ask you a few questions. And just go in and ask them some of the bipolar questions to see what you get. And again, vice versa. So anyway, I hope that information helps. I hope it's not too jumbled up there for you. This is Don Walters signing off from theclinicaltrialsguru.com. Thank you.